Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're speaking with the director of the Baptist Healthcare Foundation about how this nonprofit organization supports Baptist healthcare and the greater community. Next, we'll dive into the details of elder law and estate planning with attorney Kimberly Sullivan. Finally today, we're cooking up refreshing ideas and tips for healthy summer eating with Dr. Erin Mayfield. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. The Baptist Healthcare Foundation is celebrating their 50th anniversary. Here today to talk to us about the mission of the foundation is Director Heather Moorer. Thank you, Heather, for being here today.
Thanks for having me.
So first of all, what is the Baptist Healthcare Foundation and what does it do?
Okay. So the Baptist Healthcare Foundation is a 501c3 nonprofit organization, and we were started to support Baptist healthcare and the community.
And how has philanthropy shaped the history and the mission of Baptist healthcare?
So even before the foundation was established, our founders worked together with the community. They had a bold vision to come together and to create better healthcare for our area. The community answered that call, and Baptist was built on generosity and faith by the community. Something that's just very impactful that we still have with us today is our cornerstone that was printed back in 1950. And it was etched with these words on the cornerstone. It says, "To the glory of God and the ministry of healing made possible by the generosity of people of all faiths."
I love that.
Yeah.
So why is supporting the foundation so important for the community?
So donations to the foundation impact lives every single day. We have foundation donations that come in for emergency assistance, to help with future healthcare professional scholarships, and then also for outreach like our C.A. Weiss Christmas program.
Excellent. So this year marks a major milestone for the foundation.
Yeah.
Tell us a little bit about that.
Absolutely. So we are celebrating 50 years this year on August the 13th. We're very excited. We have not been around as long as the hospital. We started a little bit after, about 25 years after the hospital was started. But we are excited to celebrate that milestone, and we look forward to the next 50 years as well.
And what makes giving to the foundation so impactful?
So every gift that comes back to Baptist is meaningful to us. And it's really impactful because every single dollar that we raise, 100% of that donation goes directly back to help programs and services at Baptist. It can be anything from cancer care to heart and vascular services, stroke, behavioral health, mother babies. So we have a large variety of funds that we help to support and services throughout the healthcare system.
Awesome. So can you share some examples of how those donations are used? You named some programs, but what exactly would they be paying for?
Yeah, absolutely. So one of the things that we just supported was a $185,000 donation to help purchase an endo ultrasound machine. And it's something that is only offered locally by our hospital. So it's a procedure that we're the only ones in the area that does that. So that was a really cool purchase that we were able to help do some new advanced technology. Another fund that we're really proud of is our Mother Baby Fund. That one is to help moms that are in need. So if they've just had a newborn and they're not able to purchase maybe a car seat to help get them started, we have a fund available to where we can help them get that safe start.
Excellent. That's a wonderful, wonderful
a good one.
program. So tell me about the Helping Hands program and what is that?
Yeah. So Helping Hands is a program that was started for our team members, especially those that are going through an unexpected hardship. So it's funded mostly by team members and then also to help team members. That fund has grown substantially through the years, so it not only does the emergency assistance for team members, it also helps with food cards during the holidays, that CAY's Christmas program that I mentioned, and then we also were able to fund scholarships through that program. And just to share a little bit more about CA Weiss, that is probably the best day of the year for us. We love being able to support that project. What we do is we adopt every single classroom over at CA Weiss Elementary School, and all the funds come through the foundation to help cover those gifts and parties that we have for all of the classrooms. And in addition to that, we have Santa come to visit, and he typically arrives on a helicopter, and the kids just lose their mind. I mean, it is absolutely just the best day ever to see the excitement in their faces that day. So that's a good one.
Sounds very magical.
Yeah, it is.
So how does the foundation support education and also future healthcare professionals?
Yeah, absolutely. So another program we have through that Helping Hands Fund is a scholarship program. We can have team members, their dependents, and also the community can apply for a scholarship through that program. And we recently awarded 36 $1,000 scholarships. And in addition to that one, we also have a Taylor Scholarship that is specific to our team members that are going through a nursing program, and they can apply for that one. And we just awarded 6 $2,500 scholarships for that program.
Wow, excellent.
Yeah.
So helping to kind of build the workforce as well.
Yes.
and improve people's educational opportunities.
Yes, especially in the healthcare system for sure.
Yep, definitely needed. Are there any upcoming events that people should know about?
Yes, one of our signature events is our Stepping Out in Style fashion show. It is the 49th year. I don't know how many events in town have been going on for that long, but it's one that has been around for quite some time. Our women's board helps to support that event. It's going to be on October the 23rd over at Sanders Beach, and it's a lot of fun, and sponsorships are open now for that event.
Good to know.
Yeah.
So how can people get involved and support the foundation's mission?
Of course, sponsoring an event like we just talked about with the fashion show is one way to get involved. And then donating to a specific area that's meaningful to you or your family is, of course, another way that we would love for you to get involved. And then our women's board is a great group of ladies that get together and like to network and support Baptist Healthcare. We meet quarterly for luncheons. We have educational luncheons, and then we also have several women's night out events throughout the year. So that's a great one to get involved in.
Excellent. Anything else you want to let people know about the Baptist Healthcare Foundation that we haven't talked about yet?
Yeah, I think if you would like to look at our website, baptisthealthcarefoundation.org, that goes into a lot of detail about all the different programs and services that we help to support throughout the healthcare system, and also keeps you updated on all the events that we have coming up.
Wonderful.
Yeah.
Well, thanks for being here to tell us about it.
Yeah, absolutely. Thanks for having us.
Of course. Stay with us. We'll be demystifying some long-term care and legal planning issues up next.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's Ear, Nose, Throat, and Voice Center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram, or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. all when you need us most. Let Baptist make it better. Baptist Healthcare.
Long-term care and estate planning can be daunting even in the best of times, and when things get complicated, it can feel impossible. It's important to tackle this task early so that plans are in place when they're needed most. Here to tell us more about what's involved in long-term care planning and why it's important is attorney Kimberly Sullivan. Thanks for being here, Kimberly.
Thank you so much for having me.
So first of all, tell us about Coastal Probate Trust and Law and what inspired you to focus on seniors and families.
I started this practice area because I basically saw firsthand what can happen when there isn't a plan in place, but also all the things that can go wrong even when there is a plan in place. As people age, things can just become more complicated and more overwhelming. And I really wanted to make sure that there was a place for seniors and their loved ones to go to get answers to those questions, because again, it's just really daunting.
Absolutely. And we see a lot of people asking these questions as well, and we don't know all the nuances at Council on Aging, so we love to have people like you that we can defer to.
Thank you.
So a lot of people assume they don't need to worry about this type of planning until later in life.
Yeah.
So when should someone start thinking about their plan?
That's a great question. Honestly, the earlier the better. Truly, anybody who's over 18 needs an estate plan, and we hear it a lot. I don't have an estate, I don't have a lot of assets. It really doesn't matter. These documents and the plan are so important for everybody, but especially for seniors and for seniors' children, their loved ones. It really just depends on what your circumstances are. We really like to see people in their 50s or 60s have a more buttoned up and robust estate plan. But for your listeners who have children, you need an estate plan. I mean, really everybody needs an estate plan.
Absolutely. What kinds of problems do families run into when they don't have that plan in place, or when the wrong documents are in place? Like they think they have the right stuff, but they really don't.
Well, I just had this happen actually. We literally just left an initial consultation where somebody had done online documents and their power of attorney did not give them the authority to do what we need to do to get the mother on Medicaid. So a lot of people think, oh, I'll just go online and I'll pull some documents. Or, oh, I did my documents 20 years ago and they're still good. Not necessarily. Not all documents are created the same. So it can really lead to complications down the road if you don't have good documents in place, or if an estate planning and elder law attorney did not put those documents in place. It's one of those things that it is a little bit more money in the long run, but trust me, you will be so glad that you invested in this, because it's investing in your future. It is a fraction of the cost of what the expenses will be in the long run if you do this poorly.
Absolutely. So I know that you focus on helping families where dementia is part of the picture. So what makes those situations more complicated, and how can good planning help with that?
So dementia is a really interesting situation, and I know you guys are seeing this, where dementia is creeping up more and more often. A lot of people have dementia in our community, and frankly worldwide, but definitely here in our community. In dementia planning, it's really important to get your documents done as soon as possible. So the moment somebody gets a dementia diagnosis, I want to see them in my office, because while they still have capacity, we can do some really good planning to build the foundation to get them to where they need to be if a crisis hits later on. But there's a point of no return. Once somebody lacks capacity, they can't sign legal documents. And that's something that a lot of people don't think about intuitively. Like, they just don't think that, oh, yeah, you're right. Once I no longer have capacity, I can't sign a legal document. Or they might think, well, I'm not signing legal documents at that time. Well, do you need to renew your contract with Verizon? Do you need a new roof on your home? Those are all legal contracts. Do you need to go into an assisted living facility? Those are all contracts that you need to be able to sign. And if you do not have legal capacity, you can't sign that. You need your power of attorney to step in.
Gotcha. And what are some of the most common misunderstandings or myths that you hear about estate planning and elder law?
I kind of touched on this earlier, but the idea that I already have a plan in place, I did it 20 years ago, I'm good. That's not the case. It's not a set it and forget it kind of thing. You need to constantly update it. Just like your medical plans change, your legal plans change. People also think, I don't have a whole lot of money, I don't need an estate. Not the case. You need legal documents. So definitely it's better to be prepared.
And so once you get it in place, you should also be revisiting it on a basis as well, right?
Absolutely.
So We know long-term care can be expensive. What can families do to legally protect themselves, to protect what they worked for, while still getting the care that they need?
Yeah, there's lots of tools in the toolbox to help here. One of the things we do at Coastal Probate Trust and Elder Law is Medicaid planning. So people don't realize that there are programs available via Medicaid to help pay for long-term care. That's care at home, care in the assisted living facility, care at the nursing home. And this is a great option for people. It's not a perfect option, but it's a really good option for people that fit this model to get the care that they need. These are people who are too wealthy to qualify for Medicaid on their own, but they're too poor to pay for the thousands of dollars a month in facility fees to get the care that they need. But I would caution people, you have to go to an elder law attorney. There's a lot of bad legal advice out there. You need to go to an elder law attorney to do this, and don't listen to all the advice that you're going to get from random people. Wait to speak to an elder law attorney, because there are tools in the toolbox. You don't need to go bankrupt. You don't have to sell your home. There's lots of things that you can do, so make sure you get good advice from an elder law attorney.
Yeah, you don't want to commit Medicare fraud on accident.
Please don't commit Medicaid fraud, no.
Let's say someone is watching today and they feel overwhelmed by this whole topic. What's the first step they can take to get peace of mind?
Honestly, start the conversation. We're here to start the legal conversation with people, but also they need to start the conversation with their loved ones, with their children, with their spouse. People need to be honest here. If you've got a loved one who's starting to show cognitive decline or lapses in judgment, that doesn't necessarily mean dementia, but if they're getting older and we're starting to see things devolve, that conversation needs to be started. And then give us a call, contact an elder law attorney like us, and see what documents can be put in place to build that foundation, to bake in that protection for the family.
And I think there's a lot of times when families are in a little bit of denial when they do start to see some level of cognitive decline. No one wants to say, dementia, but it is so important to start those conversations. So what advice do you have for starting that conversation?
I love a situation where the family gets together, assuming they all get along, assuming the family gets along, everybody sits around with mom and dad and gently broaches the subject of, hey dad, I noticed that, you're getting lost or you're forgetting things. Now, I forget things and I get lost. Hopefully I don't have dementia, knock on wood. So you need to be cognizant and respectful of the elder person, but starting there, doing it in a safe space, being respectful of the elder, and talking to them in a loving, compassionate way. There's all kinds of resources on this as well, and we're happy to help people start the conversation also. We actually have a dementia specialist on our team who can help initiate these conversations.
Excellent.
Yeah.
Great advice. Thank you for being here.
Thank you so much for having me.
Up next, nutritious ways to upgrade your eating habits this summer. Stay tuned.
Do you want to meet a family with a transgender kid? Here we are. We love our kids unconditionally, and we will never stop fighting for them. Stand with us. Protect our families.
We are taught, you don't talk about your problems with nobody because you could get in trouble. And I've been through a lot. Anxiety, depression, sexual assault. When I decided to get help, my life changed. And the mental health box, that was one of the big tools. Accepting help means that we are allowing somebody to bless our life. It's freeing. We got stronger together. Love your mind.
Who are you?
Your lungs. Even though you quit smoking years ago, you may be at risk for lung cancer.
But with a routine screening, you can detect it early.
Learn more at savebythescan.org.
The hottest time of year is upon us, bringing endless sunshine and lots of sweat. So what are the best ways to maintain a nutrient-dense diet and stay hydrated during the last stretch of summer? We've got Dr. Erin Mayfield here to tell us. Thank you for joining us today.
Oh, it's a privilege to be here. Thank you so much for having me.
So first, tell us a little bit about yourself and your work in nutrition.
Oh, well, I appreciate you asking. Nutrition is really my jam. It's my passion, and it always has been. When I was a gynecologist in Georgia, one of my favorite things to do was counsel my annual exam patients in nutrition. And but as I did that through the years, I noticed felt like there was a missing link in what we were doing, because it was very difficult for women to lose weight, and it was easy for them to gain weight. So once I moved to Florida and I discovered this newly organized specialty called lifestyle medicine, and all of the evidence-based research around whole food plant-based nutrition, I knew that that was the missing piece to the puzzle. So what I do is I counsel people on how to change their food so that every ingredient of a recipe that they make is heart healthy, how to cook in their kitchens, and how to lose weight naturally using food as medicine. And we can do it. It's not hard. It's pretty easy. But sometimes people run into roadblocks trying to figure out the logistics of it.
Sure. Well, are there any foods that are of particular benefit to older adults?
We love whole plant foods, especially beans. Beans are a powerhouse of nutrition, packed with fiber, nutrients, and heart-healthy protein. So we love our beans, and all beans fit the bill. So white beans, red beans, black beans, chickpeas, lentils, they're all wonderful. So we know that fiber is a critical issue. Beans also have non-heme iron. Non-heme iron is a digestible iron that is also cancer protective. We know that animal proteins, the iron in animal proteins is actually heme iron, which is inflammatory and promotes the growth of cancers. So we love the non-heme iron in plants. We also love, for seniors, dark green leafy vegetables and beets. They're excellent for blood vessel health and for vasodilation, which would help lower blood pressure. There's also new research that shows that eating even one serving of dark leafy greens a day can actually improve your brain health so much that your brain can look even 11 years younger than what it is. And I know we were talking about dementia earlier. And that's a huge concern with all of us that are getting older. So we focus the nutrition on how to feed our brains.
Excellent. And I know that there's research coming out now about intensive exercise and plant-based diets related to dementia. So I have seen some about that in the documentary. So what about nutrition issues that are particular to this demographic of older adults? What are some of the things that are often a complaint for older adults?
I think the biggest complaint for older adults is constipation. And constipation circles back to not eating enough fiber on a daily basis, and also the hydration. So hydration is a huge issue. We love water. Waters are magical potion, along with the fiber, natural fiber, to help people go to the bathroom easily. And we know constipation is a very painful issue. So you eat your fiber. The goal is 50 grams of fiber a day. If people focus on eating their whole plant foods first, eating their beans, vegetables, fruits, whole grains like brown rice, multigrain rice, quinoa, if they do that first and they eat a variety of foods, then they probably will not have a problem with constipation.
Excellent advice. So what does it mean for something to be nutrient dense? If someone is maybe older and they're not eating a ton of volume of food, how can they pack in the nutrients to the meals they do eat?
Oh, that's a wonderful question, because I know there are many elderly that feel full fast. One of the things that I love and that I did for my mother was I made sure that I always had cooked sweet potatoes in the refrigerator. And we would actually give her a scoop of sweet potatoes for breakfast. So she loved her toast and her jelly. And she also had her scoop of sweet potatoes, and she thrived on that. So sweet potatoes are very nutrient dense. It's taking a food product and ounce for ounce, packing the most nutrient value into that food. And of course, that can be confusing with the term calorie density, which we know means that it's got the highest number of calories for that particular measured amount of food. So we want nutrient density and not calorie density.
And what are some ways to add nutrient dense foods to a diet in the summer?
There are many ways to do that. One of the ways to do that is to focus on eating fruits and vegetables. And it's important to know that all of the colors in the produce department, all of the fruits and vegetables, all of those colors mean something. So we encourage people to eat the rainbow, eat a variety of colors of fruits and vegetables, the oranges, the yellows, the purples, the blues, the greens. Those are, when you eat a variety of those, then you're going to get that nutrient density naturally. So you don't have to worry about counting
Right.
Nutrients. One other point that's really critical about eating fruits, vegetables, and beans is that they're full of complex carbohydrates. And complex carbohydrates feed our gut bacteria. They're healthy food for our brains. So we want to stay away from the simple carbs, but know that there's this critical division between the complex carbs, which our body craves, and the simple carbs, which are driving diabetes, weight gain, and are not healthy for our brains.
Gotcha. So eat a rainbow and get that good type of carbohydrate.
Yes.
So what are some tips for staying hydrated in the summer that you would give to maybe older adults or their caregivers?
Of course, it's drink water, but it's hard to keep track of that. So one thing that I've always encouraged people to do is to take one water bottle or glass where you know how many ounces the glass contains. And that way you can watch it through the day. It's also a big issue for my teachers. What do you do when you can't just leave the classroom and run to the bathroom? Mm-hmm. Same thing with older adults. It's not necessarily even easy to get to the bathroom sometimes, but you can time it. So you have a 16-ounce glass of water. You wake up in the morning, you're already dehydrated from sleeping all night. Go ahead and drink that 16 ounces of water first thing in the morning. And then add another 16 at lunchtime. Add another 16 at 4 p.m. Don't drink right before you go to bed. You don't want to be up all night, disrupting your sleep going to the bathroom. But you can easily get in that 2 quarts of water a day just by timing it and having that one glass that you know how many ounces
and just
is
being
contained in that glass.
Mindful throughout the day. Mm-hmm. Excellent. Well, this is good advice for older adults and I think everyone pretty much.
Yeah.
So thank you for sharing this.
Thank you so much.
And thank you for watching. Until next time, enjoy life. You've earned it.